been a number of recent headlines about patients getting price gouged when asking for copies of their medical records. In some cases, patients have allegedly been asked to pay $1,000 or more. Some of this is a result of confusion over what the Department of Health and Human Services deems to be a reasonable cost. Newer government guidance intends to make it easier for patients to get their records, but patient advocates define reasonable cost a little differently than providers. The Journal asked Sarah Goldstein, General Counsel for the Release of Information firm MRO, to offer a provider's perspective.
If the requester is the patient or the patient's personal representative, meaning that they are the healthcare power of attorney or the parent of a minor patient and they can make healthcare decisions for that patient, then the only fee that they can be assessed would be a reasonable cost-based fee under HIPAA. State law would only apply to the fees that could be assessed if that state law does in fact state that records should be provided for free to the requester. So there's a few states that have that law in place, one of which is Kentucky. So in any other circumstance, chances are HIPAA and the reasonable cost-based fee and what actual labor costs and actual supply costs can be included in that fee will be less than what fee schedule the states have implemented under statute or regulation. So it should not matter what state the patient is requesting copies of protected health information from, unless the state has a law like Kentucky where copies of records are provided for free. The reasonable cost-based fee under HIPAA would apply to all of those requests.
But, Goldstein adds, some providers may just plain not be familiar with the most recent regulations and charge patients according to their own facility-designed fee schedule. To encourage more transparent access, advocates say providers should charge as little as possible. The Journal asked Erin McKay, who works on the Get My Health Data Project, run by the National Partnership for Women and Families, for her view.
Well, I don't think that I can speak to what's reasonable for every individual consumer because I think it's very person and context specific. But I do think that it's important that fees appropriately reflect the costs that are involved with producing copies. Like you mentioned, what's allowable under HIPAA. The other thing is that I'll say that the National Partnership for Women and Families and our Get My Health Data Project really strongly agree with HHS's position that covered entities should be making health data available to patients free of charge, regardless of the fees that they are allowed to charge for labor and supplies and for postage. It just seems that, seamless access to electronic health information is critical to making patients and families true and equal partners in improving health. And if that is a goal that we're aspiring to, then, offering access to information free of charge is a strategy to achieve that. We don't ask people to manage their finances without online access to banking information, which is usually free. But, somehow we expect patients to manage their health and their care without similar access. So I think the bottom line is that giving patients access to their health information free of charge should be part of the cost of doing business in 21st century healthcare.
The debate about fees, however, provides an opportunity to educate patients about health costs and access to their information, according to McKay.
First of all, increasing awareness of the OCR guidance, that it's out there and what it says, is going to be a really important first step. And again, I think this overall transition to a digital ecosystem, really we just need to be returning to how we are putting together charges, how we are, trying to assess labor charges. It's, there are efficiencies that are gained in an electronic system, things like the per page fee schedule, just they don't account for our more digital system.
This has been Mary Butler reporting for the Journal of AHIMA.